Hello and welcome to this presentation of the Northwestern University Postdoctoral Benefit Program Overview, presented by Gallagher Benefit Services. We are the insurance broker and administrator for the Northwestern University Postdoc program. On the agenda for the presentation today is a review of the benefits and plan designs available to you through the benefit program, as well as an explanation of the enrollment process. Northwestern University has partnered with Gallagher Benefit Services to administer the postdoctoral benefit program. This program ensures that all postdoctoral trainees, regardless of their funding source, now receive equivalent benefits. This is to protect you against having to enroll or unenroll in insurance if you are classified as one postdoc versus another, going on or off an NRSA grant, et cetera. And the PSBP package is designed to closely match the benefits offered to the Northwestern University faculty staff. Here's a quick overview of the insurance plans offered through the benefit program. As you can see here, there's an HMO as well as 2 PPO medical plans offered through Blue Cross Blue Shield of Illinois. We have an HMO and PPO dental plan offered through the Guardian, PPO vision plan offered through EyeMed, basic and voluntary life and accidental death and dismemberment plans offered through the Standard, as well as short-term and long-term disability plans offered through the Standard. Getting into the medical insurance provided by Blue Cross Blue Shield of Illinois. First, we will go over what an HMO plan is. An HMO plan, HMO stands for Health Maintenance Organization, is a plan designed to control costs for the member. And the way they do that is by requiring the designation of what's called a primary care physician, or PCP. And a PCP is a general practitioner that you will choose at the time you enroll. If you do not choose a primary care physician, one will be assigned to you. And each family member can have a different primary care physician, and that primary care physician acts as a healthcare gatekeeper of sorts, meaning that if you have an illness or injury, you will go to that primary care physician first, and they will refer you out to a specialist in the same medical group if they're not able to diagnose and treat whatever it is you're visiting them for. It's important to note that you are able to change your primary care physician up to once a month if you're not satisfied with your initial choice. The insurance company understands that, sometimes there's some trial and error involved in choosing a primary care physician, so you are able to change that PCP up to once a month. Additionally, with the HMO plan, there is no out-of-network benefit unless you're experiencing a life-threatening emergency. So it's very important that you stay in-network under the HMO plan. So here is a very high-level overview of the core benefits under the HMO plan. These are the most commonly utilized benefits, the benefits that most people are concerned about when they're looking at plans. However, if you would like to view a more detailed plan document that goes into more depth, feel free to visit the website at nupd.gpa.services, navigate to the documents library, and you'll see much more comprehensive plan documents available there that you can review at your convenience. So under the HMO plan, you'll notice there's just the in-network tier. You have your deductible, which is for the HMO plan, nothing. There's no deductible associated with the HMO plan. Then you have your out-of-pocket maximum, which is the maximum amount that you would be responsible for paying toward your medical care in a given plan year. Once you've paid out-of-pocket $1,500 as an individual or $3,000 as a family toward medical services, the insurance company pays for your medical costs for the remainder of the year. There's a separate prescription drug out-of-pocket maximum, $1,500 for an individual and $10,200 for a family. If you have an office visit with a general practitioner or your primary care physician, you're going to pay a flat $25 copayment. If you are referred to a specialist, that specialist office visit is going to be a $35 copay. You have an annual wellness visit available to you at no charge. So once a year, you can take advantage of this annual wellness visit. It's important to point out, however, that if you are to visit your primary care physician for this annual wellness visit, that you do not bring up any illnesses or injuries during the visit, because it is strictly supposed to be a wellness visit. So if you go in for your wellness visit and the doctor asks, you know, is there anything bothering you before you go, and you mention this pain you've been having in your elbow, they're going to code that visit as a regular office visit because the doctor basically, you know, diagnosed and treated you for that elbow pain that you were having. So it's important to keep that in mind. If you need to be admitted to the hospital, regardless of the number of days you're in the hospital, you pay a flat $500 copayment per admission. If you need to have a same-day outpatient surgery, you pay $250 per visit. And then if you need to go to the emergency room, it's a $150 copayment. But if you're admitted to the hospital as a result of that emergency room visit, that copayment is waived. Last but not least, you have your prescription drug benefits and copayments. You pay a flat $10 for your Tier 1 drugs, which are your generic drugs. They've typically been on the market for quite a while. There are lots of generic options, and therefore the costs are lower. You're paying a $30 copayment for your Tier 2 drugs. These are your brand name drugs that are relatively new to the market. There aren't generic options, only brand options, so they're a bit more expensive. And then you have $60 copayment for your Tier 3 drugs. Tier 3 drugs are typically your more cutting edge drugs that are brand new to the market and therefore are a bit more expensive. And then last but not least, you have your Tier 4 specialty drugs at a $90 copay. Think insulin, that type of specialty drug. That's a $90 copay. And all of these copayments are referring to a 30-day supply for that particular drug. Moving on to your PPO plan options, just a quick overview of what constitutes a PPO plan. PPO stands for Preferred Provider Organization. And unlike the HMO plan, you do not have to choose a primary care physician, and you can self-refer to specialists. Additionally, you have the option of going to out-of-network providers. If there's a doctor you'd like to see that isn't in the Blue Cross Blue Shield of Illinois network, you can still see that provider under the PPO plan. Your out-of-pocket costs are going to be higher, as you'll see in a moment, but that option is on the table for you. So here is the base PPO plan. As you can see right off the bat, different from the HMO, you have your out-of-network tier that's there. I'm going to focus, for the sake of this presentation, on the in-network benefits of the PPO plan, but as you can see at a glance, your out-of-pocket costs are higher out-of-network. So in-network on the PPO plan, you'll see there is a deductible, which is different from the HMO. Your deductible is essentially the amount that you have to pay before your plan kicks in. So just like with car insurance, if you get into an accident, you might have a $250 or $500 deductible that you have to pay before the insurance company pays for the remainder of your repairs. It's the same basic concept for a medical plan. So you pay that $750 for an individual up front once you need to access care, and once that $750 is met, the benefits under the plan begin to kick in. Your out-of-pocket maximum, again, the maximum amount you'll pay in the given plan year under the PPO is $3,000 for an individual and $8,000 for a family for medical services. And then you have the separate out-of-pocket maximum for prescription drugs, which is $1,500 for an individual and $5,450 for a family. Your office visit copay is $25 for a general practitioner and $35 for a specialist. Again, you have an annual wellness visit available to you at no cost. Your inpatient hospitalization coinsurance is 20% of the total bill. But as we've discussed previously, that's 20% up to your out-of-pocket maximum, which on this plan is $3,000. So let's say you have a $50,000 hospital bill. You would pay the first $750, that being your deductible. Then you would pay 20% of the bill up to $3,000, and then the insurance company would pay the rest. You also have a 20% coinsurance for your outpatient surgery. Emergency room is a $150 copayment plus 20%. Once again, that copayment is waived if you're admitted to the emergency room. And then lastly, you have your prescription drug benefits again, $10 for Tier 1, $30 for Tier 2, $60 for Tier 3, and $90 for Tier 4. Again, all for 30-day supply. And just like with the HMO plan, more detailed plan documents are available in the documents library. In addition to the base PPO option, you also have the availability of a buy-up PPO medical plan. The PPO plan functions in the same way. Your out-of-pocket costs are just a bit lower, and as a result, the plan's a bit more expensive for you. However, if it makes sense for the level of medical care you anticipate yourself needing in the plan year, this may be a better option for you. So as you can see, the deductible is lower than the base PPO at $500 for an individual and $1,500 for a family. The out-of-pocket maximums are also lower, $1,800 for an individual for medical services and $4,800 for a family. Your office visit copayments are lower, $10 for a general practitioner and $20 for a specialist. Annual wellness visit is the same at no charge. Then your inpatient and outpatient hospitalization coinsurances are lower at 10%. And then your emergency room copay is still $150. However, you're only paying 10% coinsurance on top of that instead of 20. And then again, you have your Tier 1 through 4 prescription drug copayments here listed. So summaries of benefits and coverage are documents that I am particularly a fan of because they very much help with comparing plan options. Before the Affordable Care Act, insurance companies were allowed to format their plan information however they saw fit, which resulted in every insurance company having a different format for their benefits, and sometimes even within the same insurance company, just across different plans, their formats would be different, and it made it very hard to compare plan information. What the Affordable Care Act mandated was that these summaries of benefits and coverage needed to be provided by the insurance companies, and they all needed to fit a uniform template that the government provided. This means that it's very easy to open a summary of benefits and coverage for each individual plan and compare the plans line by line to see how they differ in terms of your out-of-pocket costs. So if you are having a hard time deciding between any of the plan options, I highly recommend going into the documents library, opening a copy of the summary of benefits and coverage for whichever plans you're choosing between in different tabs, and then you can switch back and forth between the tabs and go line by line and see how the plans compare. Okay, urgent care facilities. This is an important topic that we want to touch on with you because they are an excellent alternative to the emergency room, which we see get utilized more often than it needs to be. Urgent care facilities are excellent outlets for non-emergency, non-life-threatening care. Now, if you go to the emergency room with let's say, a cut finger, your cut finger is bleeding pretty profusely, it definitely needs stitches. And so you go to the emergency room thinking that's the best place to go. However, with the emergency room, the staff there is triaging everybody that comes into the emergency room based on the severity of their illness or injury. So you have people coming in with head trauma, you have heart attack victims, stroke victims, what have you. coming in, and they are all going to be triaged and placed ahead of you in your cut finger, which means that you could sit in an emergency room for hours or even an entire day waiting for that cut finger to be treated by a physician. And then once you are seen, you're paying a $150 copayment, which is much more than an urgent care copayment. So rather than going to the emergency room, you can go to the nearest urgent care center. With urgent care centers, when you enter the facility and sign in, the staff goes down the sign-in sheet in the order in which the people arrived. So you are not being pushed back to treat more severe illnesses or injuries. You're going to be seen in the order that you arrived. And urgent care centers have licensed physicians and staff perfectly capable of taking care of non-life-threatening illnesses and injuries. So that's going to save you a tremendous amount of time and also save you some money. As you can see, the copayment for an emergency room visit on the HMO plan is $150 copay versus just $35 for an urgent care center. And then on the PPO plan, you're paying $150 plus 20% to go to the emergency room versus just 20% for an urgent care office visit. A couple of notes, HMO members, you will need to consult with your primary care physician first to see if any same-day appointments are available. If not, the PCP office will refer you to an in-network urgent care center that you can then go visit that same day. PPO members can go directly to the nearest in-network urgent care center. No referral from a PCP is required. And there are 32 urgent care centers within 10 miles of campus, just to give you an idea of how prevalent these urgent care centers are and available to you. So with all of the talk regarding how to access in-network and out-of-network providers, we want to make sure that you have the tools available to you to help you navigate who's considered in and out of network. So we've provided instructions on the website that you can access at any time. And just click on Find a Provider, choose which type of provider you're looking for, and there will be a PDF that walks you through step-by-step how to access and utilize the online provider directories to find in-network providers in your area that accept your plan. So definitely recommend utilizing this tool available to you on the website. So the medical plans available to you have a built-in wellness program, or several built-in wellness programs rather. And so as long as you enroll in the medical plan or a medical plan, these wellness programs are available to you by default. I'm not going to go into each of these in depth. There's a wellness section on the website that contains PDFs for each of these different programs that you can review at your leisure. It goes into much more detail on each of these. So I highly recommend you looking at these at your earliest convenience. So also available through the benefit package, however administered by Northwestern University, is a flexible spending account. So the flexible spending account is not administered by Gallagher Benefit Services. However, it is available to you through Northwestern University. So feel free to contact the HR department regarding an FSA, your eligibility, and how you can enroll in and contribute to that. Additionally, there's also a dependent care program available to you. So again, feel free to contact NUHR to determine your eligibility and how you can enroll in that program as well. So there are other benefits if you're considered a university-employed postdoc, meaning you're paid a salary. These benefits are available to you. You can also verify via the job codes included under each benefit your eligibility. These are benefits administered by Northwestern as well, but we want to make sure that you're aware of their availability to you if you're eligible. So review these at your leisure and contact Northwestern HR if you have any questions. Okay, getting into dental insurance provided by the guardian. So here you can see the HMO dental plan. It may look similar to the HMO medical plan, which is kind of by design. Just like with the medical plan, your HMO dental plan, you have to choose a primary care dentist or a PCD. Just like with the medical, where you choose a PCP, on the dental, you need to choose a PCD. And just like with the medical, they will be your gatekeeper for your dental care, and they'll refer you out to any dental specialist that they need to if they can't diagnose or treat whatever dental issue you're having. Right off the bat, you'll notice there's no annual deductible, which is excellent. Next, you'll see that there's an annual benefit maximum. It's unlimited on this plan. And I just want to clarify that the annual benefit maximum is different than the out-of-pocket maximum that we discussed with the medical plans. The out-of-pocket maximum on the medical plans refers to the most that you are going to pay toward your insurance, toward your medical care in a given plan year. Whereas the annual benefit maximum on the dental plan refers to the maximum amount that the dental insurance company is going to pay toward your dental care. So it's a very important distinction that you want to make sure you understand. One is the max that you will pay, whereas the dental benefit maximum is the max that the insurance company will pay. Getting into the preventive and diagnostic care, you'll see that your routine exams, teeth cleanings, and x-rays are at no cost to you. Then we get into basic and major procedures. And you'll notice that we have listed here that co-payments vary up to a certain dollar amount. And the reason why we have it listed here like that is because there are, very lengthy benefit summaries for HMO dental plans that are sometimes referred to as co-pay schedules, and they include, sometimes 6 or 7 pages of every single procedure that you could possibly have done under the dental plan and the associated out-of-pocket cost for that procedure. So obviously we can't fit all of that on one slide. However, if you want to, look at the plan in terms of what each individual procedure will cost you out of pocket, we do have those plan documents available in the document library on the website for you to review. Lastly, this plan does have orthodontia coverage for for children and adults. It's still a significant cost, although it is much lower than what you would pay if you were an uninsured patient undergoing an orthodontia case. Okay, so getting into the PPO dental plan, you'll notice just like with the medical, there's also an out-of-network tier for this PPO dental plan. And in the out-of-network tier, you'll see that there's a co-insurance of UCR. And on the next slide, we'll get into a bit more detail on what UCR stands for and how that impacts your out-of-pocket costs. But for now, we'll focus on the in-network benefits of the PPO dental plan. You'll notice that there's a deductible on the PPO dental plan of $50 for an individual and $150 for a family. Then there's an annual benefit maximum of $3,000. So this is the maximum amount that the insurance company is going to pay toward your dental care in the year. So keeping that in mind, if you are in a situation where you're going to need a significant amount of basic or major work done in a single year, and you think that you might go over that $3,000 mark, you may want to go with the HMO plan because it's unlimited. However, if you just need your preventive work done and you think you may need 1 or 2 basic or major procedures that'll keep you under that $3,000 threshold, then the PPO plan may be the option for you. You'll also notice that there is orthodontia coverage under the PPO dental plan, but for children only. And there is also a $3,000 lifetime max on the ortho. So once the guardian pays $3,000 toward the orthodontia coverage, they're not going to pay anything else toward that ortho for that particular person. Okay, so digging into the meaning behind the UCR language that you saw on the previous slide, when you seek services in network, you pay less for care. And the reason for that is because the dentists in network have agreed to discounted contracted rates that they cannot change. Those are locked in with the insurance company. So when you pay 50% for a major service from an in-network PPO dentist, you're paying 50% of a contracted discounted rate. This isn't the case with out-of-network providers. As an example, you go visit an out-of-network dentist that charges $1,000 for a porcelain crown on a molar, and this dentist can charge $1,000 because they're not in network. They haven't agreed to charge any less with the insurance company. Your percentage of the cost for out-of-network care is 50% after a $50 deductible. Now, if you were having this procedure done by an in-network dentist who has agreed to the usual customary and reasonable rate of $800 for a crown, you would pay $425. But since you're going to an out-of-network provider, in addition, you owe the difference between the UCR amount of $800 and what the out-of-network dentist is actually charging, which is $1,000, and that's an additional $200. So that difference between the UCR rate of $800 and what the dentist is actually charging, $1,000, gets tacked on to your total cost for the crown on a molar. So what you would have paid $425 for under an in-network dentist, you're all of a sudden paying $625 for, because you're covering 100% of that difference between the UCR rate and the rate that the out-of-network dentist is charging. So it's important to keep this concept in mind if you elect the PPO dental plan, and specifically if you decide to access out-of-network care under that PPO dental plan. All right, onto the vision insurance provided by EyeMed. Now, vision insurance plans are very simple and straightforward for the most part here. As you can see, there's an in and out of network component. The EyeMed network is so robust that there's typically no reason to ever need to see an out-of-network optometrist, so I'm going to focus on the in-network benefits for this plan. As you can see, it's broken down into kind of three components. You have your vision examinations, which are a $10 copayment. You have your corrective lenses, which are a $10 copayment. Or if you decide to, instead of use the corrective lens benefit, use a contact lens benefit instead, you'll be granted a $200 allowance toward the cost of those contacts plus 15% off your remaining balance. So you can choose either within your 12-month benefit period, you can choose to either get new eyeglass lenses, corrective lenses for $10, or you can opt to have the $200 allowance toward the cost of your contacts. It's an either or situation. And then last but not least, you have your frames benefit, a $200 allowance, and then 20% off the remaining balance. So a typical, visit to the optometrist will, look like an examination. Then you'll make a decision between whether you want corrective lenses or contact lenses, or whether you'd like to use your benefit toward one or the other. Rather, you can get both if you want to pay out of pocket for those, and then getting frames for those corrective lenses if you are in the market. Now, the way that the frames allowance works is because you have a $200 allowance. Let's say you purchase a pair of frames that are $130. That's great. It's under the $200 allowance, so you don't pay anything out of pocket for those frames. You don't get the extra $70 back, but you don't owe anything out of pocket. Now, let's say you want the really expensive designer frames that are $250. Then the optometrist office is going to take $200 right off the top, and then they're going to reduce that remaining $50 you owe by 20%, and then charge you the remainder. And last but not least, for this vision plan, I just want to go over, as you can see here, under each different category of benefit, there's a every 12 months listed. That's the frequency at which you can use each one of these benefits. They typically all get used at the same time, but it's also important to note that the 12 months begins from your last date of service. This is not tied to the calendar year. So let's say you were to, go to the optometrist on January 12th. You would be eligible to go back to that optometrist with full benefits January 12th the next year. All right, on to the life and AD&D insurance provided by the standard. Okay, so the basic life and accidental death and dismemberment plan. It's not a pretty name, but it's important coverage to have. This plan pays you $50,000 in the event of your death, and an additional $50,000 is paid for the AD&D portion if your death is due to an accident. If you're a J1 scholar, it's important to note that this basic life and AD&D plan also includes the medical evacuation and repatriation coverage that's included or required rather for your J visa requirements. And it's included for you and your dependents, so you do not need to purchase any additional supplementary medical evacuation and repatriation coverage to meet those J visa requirements. That is included with your basic life and AD&D plan. This benefit's provided to you at no cost by the university, and it is for employed and NRSA postdoc trainees only. If you're a paid direct postdoc, you do have access to this coverage, however, it is at your own expense. Voluntary life insurance, also provided by the standard. So as you can see here, there are different voluntary life insurance products available to you. You have postdoc voluntary life insurance. So this is coverage that you can elect for yourself. You can elect up to 5 times your annual salary, up to $500,000. There is a guaranteed issue amount for this coverage, which means that this is the maximum amount you can elect without completing a medical questionnaire that requires approval from the insurance company. So you can elect up to $150,000 with no medical questions. If you want to elect more than that, that's fine. There's this additional approval process involved and a medical questionnaire that you need to fill out and submit. There's also spouse voluntary life available in units of 10,000 up to a maximum of 250,000. It's important to note that you can't enroll your spouse in more life insurance than you enroll yourself. So the amount that you choose for your spouse must not exceed your own voluntary life insurance amount. And the guaranteed issue amount on spouse life insurance is $30,000. So anything above that, again, just like with your postdoc voluntary life insurance, would require a medical questionnaire. And lastly, you have child voluntary life insurance, which is available in units of $1,000 up to a maximum of $10,000. And again, the child life insurance can exceed your own, which you don't typically see happen anyhow. All right, income protection. It's a very important benefit, also provided by the standard. So outside of the coverage offered by the standard, you have an extended sick time program offered through Northwestern University. And this program is only available to employed postdocs. NRSA and pay direct are not eligible for this. But this extended sick time or EST program takes the place of a short-term disability plan. Eligible employed postdocs are automatically enrolled in EST 6 months after your original hire date. This happens automatically, no enrollment's required. And if you experience an accident or illness, you need to file an EST claim and meet the criteria below in order to receive the benefit for that. Benefits are payable for up to 25 weeks, and the EST program is provided at no cost to the employed postdocs. So for those NRSA and direct pay postdocs that are not eligible for the EST plan, Northwestern is providing this short-term disability STD plan. Enrollment is required to receive this coverage. The plan pays a weekly benefit of 60% of your pre-disability earnings. If an STD claim is approved, your benefits become payable after you've been continuously disabled for 7 days, and the maximum benefit period is 173 days. The plan covers non-work-related disabilities only and has a pre-existing condition exclusion for those postdocs joining outside of the period of initial eligibility. Next, on to long-term disability insurance, which is the plan that will kick in if you exhaust your short-term disability insurance. So the first long-term disability plan option is offered through an insurance company called the Hartford, and this one is available to employed postdoctoral trainees only, and this plan is administered by Northwestern University. NRSA and paid direct postdocs are eligible for coverage through the standard for LTD, and we'll go over that on the next slide. But for now, this Hartford plan for the employed postdocs, enrollment is automatic. The core plan will pay 50% of your monthly pre-disability earnings. There is a buy-up plan option that does pay 60%. And if you combine that with Social Security disability income, you can get that up to 70% of your pre-disability earnings. If your LTD claim is approved, benefits will be payable after you've been continuously disabled for 6 months. And the benefits are payable until you reach normal Social Security retirement age. And last but not least, there is a pre-existing condition clause on this plan that states ailments diagnosed or treated during the 26 weeks prior to your enrollment in the plan won't be covered under the LTD plan until the plan has been active for 12 months. You'll also notice there is a little asterisk at the bottom there that directs you to where you can look for the rates for the LTD buy-up plan that does pay 60% rather than the core 50%. And the second long-term disability plan is offered through an insurance company called The Standard, and this plan is available to NRSA and direct pay postdoctoral trainees only. As we just discussed, the employed postdocs are eligible for the faculty staff LTD plan through the Hartford. For this NRSA and direct pay LTD plan, enrollment is required to receive the coverage. This plan also pays 50% of your monthly pre-disability earnings. If approved, your benefits are payable after you've been continuously disabled for 180 days. And just as the previous plan, payments are made up until the Social Security normal retirement age. And the pre-existing condition exclusion on this plan is anything diagnosed or treated in the 3 months prior to your enrollment will not be covered until the plan has been active for 12 months. Okay, on to the enrollment process. So first off, you have 31 days from your appointment start date to submit your enrollment and benefits. This 31-day window is called your period of initial eligibility. And you need to complete your enrollment during this time. So in order to enroll in benefits, please follow the steps below. First, you'll visit the website at nupd.gpa.services. You'll fill out the required information to register as a new user. As you can see there, it's the date of birth, NUID number. You'll create a password, confirm your password, and then create an account. It's important to note that if you're having difficulty registering as a new user, it's very likely because we have not received your information from Northwestern University yet, which in turn means that your payroll record has most likely not been finalized in their system. But if you're unsure about your status, feel free to contact our office and we can check with Northwestern to see where you're at in that process. So once you've registered as a new user and you're viewing the enrollment wizard, you're going to go ahead and interact with the required fields and progress through the wizard in order to indicate which plans you want to enroll in, enroll any eligible dependents, or waive coverage for you or any eligible dependents.
It's important to note that if you're adding a dependent to your health insurance, you'll need to provide documentation to prove dependency. You can upload these documents during the enrollment process. And if you're unsure about which document you can provide to prove dependency, we do have a dependent verification section on the website that lists all of the acceptable forms of documentation for each type of dependent that you're adding. Okay, so once the enrollment wizard's complete and you've gone through all the steps, you're just going to want to click on the acknowledgement boxes and then click Finish Enrollment. An electronic copy of that enrollment form is going to be submitted to our secure database for enrollment and billing purposes. And of course, you have the option of printing a copy of that enrollment form for your records as well. Processing time is really dependent upon when we receive your information from Northwestern, but typically we process enrollments within 1 to 2 weeks. However, feel free to contact us if your enrollment or change is not reflected or completed within that time period, or especially if you have a more immediate need for care. If you need to see the doctor on or after your appointment start date, before that 1 to 2 week period, after you've submitted your enrollment form, please don't hesitate to reach out to our office so we can get you taken care of with more urgency. And lastly, your new ID cards, if applicable, will be mailed to your home directly from the insurance carriers.
A bit on qualifying life events. As we discussed, you have your period of initial eligibility, which is when you are required to submit your enrollment. However, we understand that there are life events that can occur throughout the year outside of that period of initial eligibility or even the annual enrollment period, which would require some flexibility in terms of allowing you to enroll dependents. These qualifying events can include, but are not limited to, marriage. Obviously, you can add your new spouse. Divorce, you can remove a former spouse. If you give birth to a child, obviously, you can enroll that child within, their 31 days of their birth. If you adopt a child, entrance into the United States is a very popular one because a lot of time international postdocs will arrive in the United States a month or two ahead of their dependents, and doesn't make sense for you to be paying for coverage that they can't use while they're not here. So when your dependents enter into the country, that's a qualifying event to add them to your coverage. Also, if a dependent is enrolled in a different plan, or if you're enrolled in a different plan and that plan ends, you then become eligible to enroll in the Northwestern postdoc insurance. A few things to note: documented proof of the qualifying event will be required. And additionally, the window to take advantage of a qualifying event is 31 days from the date of that event. So using marriage as an example, you have 31 days from the date you were married to submit your request to enroll your new spouse. And the same applies to any of these additional qualifying events. Thank you for taking the time to review this presentation. We hope the information was helpful. Here's some contact information for our offices, a phone number, email address, and the website as well. There's also an FAQ posted on the website in PDF format for you to review at your leisure as well. We welcome you to contact our office via phone or email, whatever's most convenient for you if we can be of any assistance. I hope all is well. Enjoy the rest of your day.